Hi, Lindsay.
Hi.
Welcome to the office. My name is Dr. Perez. I have you in for a complete head-to-toe assessment today, and we do have quite a few things to go over. So if it's all right with you, I would like to go ahead and get started. Okay, perfect. So I am just going to finalize your check-in. Already have most of the preliminary stuff done, so that is great news. Now I saw that you spoke with the nurse and your vital signs were taken and everything did look normal there, so that's lovely. I did just want to ask you, is there anything specific that brought you in today, or are we just doing kind of an annual new patient assessment?
Yeah, just an annual assessment.
Okay, perfect. That's very good news. If there's nothing specific, then we can go ahead and jump right in. Alright, well, like I said, we have quite a few things to go over, so essentially I will just be working from head to toe. I'll have a look at your head, at your scalp, of course, do a brief eye exam, ear exam, have a little look at your nose and throat. I do specifically want to look at the neck, lymph node, thyroid area, of course, do an examination of your extremities, and then I'll have you lay down, do a bit of an abdominal examination as well. Okay? Alright, so we can go ahead and begin. So I'm just going to start with a basic visual inspection. I'm going to be using my pen light to have a look, do an assessment of your facial symmetry, and just have a look at your overall posture and see if there's anything kind of misaligned or anything concerning before we move in. Okay? Alright, so just starting with an overall inspection of your posture, having a look at your basic facial symmetry. I'm not noting any abnormality there. Very good. Overall shoulders are fairly aligned. Okay. Alright, so I'm going to begin with a bit of an up-close inspection. I will be using my hands to just manipulate you slightly. Is that okay?
Yep.
Okay. So I'm going to come and just have a peek from behind first. So just looking at the neck and spine areas. Very good. Now facial symmetry is fairly even. I'm not noting any atrophy, no muscle wasting. Can I just have you do a soft smile for me? Very good. Okay. I will have a brief look at your scalp, make sure there's nothing notable going on there. Just gonna have a look at your ears. I do see that you have one piercing, appears to have healed well. Same on the other side. Alright, so I'll just have a look at your hands if that's okay. Skin is warm and dry to the touch. You see a little bit of redness at the hands. No signs of palmar erythema. So I'll do a brief joint assessment when I have a look at your upper extremities a little more in depth. Fingers are just a touch cold. Is that normal for you? Okay. All right. Perfect. Okay. Let's go ahead and relax for me. We can start with a bit of a test for temperature variation now. Although the nurse did take your vital signs, I do like to just go over and make sure that I'm not getting any abnormal temperature variation, specifically around the neck area, just ruling out any signs of infection or inflammation. Okay, so I'm just going to check in a couple areas here. I'm getting slightly warmer here behind the ear. Let me see if that's the same. degrees warmer here on the left. Any pain or tenderness behind your ear?
No.
Okay, so it could just be a normal variation. So I'll assess that further when I do your lymph node examination. I do feel maybe slightly warmer to the touch here. All right, so moving on to your ocular examination. Now you do have very light eyes. Do you have any light sensitivity ever?
A little bit.
A little bit. Okay, so I tend to see that in patients who have either blue or green eyes. So I'll try not to be too aggressive with my pen light, but I am going to have a look at your pupillary reaction. So if I could just have you find a spot on the wall across from me there. Just going to bring this into your field of vision. Very healthy pupillary reaction. Very good. Okay, perfect. This is an ophthalmoscope. It's a device that's going to allow me to view your optic disc as well as some of the nerves at the back of your eye. So I'm going to have you look straight across the room for me. It is fairly bright. Try not to look directly at the light, okay? Coming very close to your face now, so I do apologize here for getting in your personal space. And I'm going to bring my finger. Can you see this here? Follow the finger for me. Perfect, okay. Same thing on this side. Coming in from this side. Can you see my finger? Beautiful. Okay, so optic disc is round and normal in color and size. All right, Lindsay, I have two different colored test tubes here. One is gray and one is yellow. I'm going to ask you to switch your gaze to either color. So I'll call out either gray or yellow. Depending on where I have it located, I'd just like you to look over at that tube. Okay? So I'll start with both of them here. And if I could have you look at the gray and back at the yellow. Perfect. And look at the gray and back at the yellow. Very good. Now look at the yellow and at the gray. And look at the yellow and at the gray. Very good. I'll have you look at the gray and at the yellow. Perfect. Okay, so no sign of delay there, which is very good. So I'm just going to take a quick note here, just updating. So your ocular examination was well within normal limits, no issues there. I didn't have it notated that you wear any prescription glasses or contacts, is that correct? Perfect. Okay. So we are going to move on, and I'm just going to keep moving down the face. So I think the next thing I'd like to test is your nasal patency as well as a brief oral examination. So switching over to my otoscope. Any issues with nasal patency, seasonal allergies, or stuffiness of the nose? Okay. if I could have you tilt your head back for me just slightly. I'm just going to have a brief peek inside your nares. And just looking for any signs of occlusion, deviated septum, none of which are notable. So if I could have you open and say, ah.
Ah.
Very good. Uvula is midline, tonsils are not enlarged. Can you smile for me with teeth? No teeth? Very good. Okay. Do you see a dentist semi-regularly? You do have beautiful teeth. So, as far as your oral examination, different tests here. First, testing for nasal patency. I'm going to include either nair. I'd like you to just take a breath in. Okay? So go ahead and breathe in for me. In here. Beautiful. No issues with that. I'm going to wave something in front of your face. I'd like you to tell me what you smell, if anything. Okay?
Rubbing alcohol.
Very good. Okay. Good job. Slightly uncomfortable test of your gag reflex, if I could have you open for me. Good. Okay, so no issues with that. Apologize for that. I know it's not the most comfortable thing, but you did very well. So we can go ahead and continue, and I think I would like to have a brief look in your ear since I have my otoscope ready. Now, do you ever have any issues with your hearing? No. Did feel just a little bit of warmth behind this ear, so I do want to have a closer look at that, but first just making sure there's nothing in the ear itself. So I'm just going to pull here, a little up and back, might feel slightly ticklish. So having a peek at the ear canal. You do have very shallow ear canal here. The tympanic membrane is visible. Normal in color, no signs of redness. See some slightly darkened wax, but nothing I would say is particularly concerning there. Okay. Just going to do the same on the other side. Okay, so same thing, slightly shallow ear canal, but tympanic membrane is normal in color. Now, I do see slightly more darkened wax on this side. Do you use Q-tips to clean your ears?
No.
No. Okay. So it doesn't appear as if the earwax is impacted. It does just look a little bit darker than I would typically like to see. But if you're not having any issues or any itchiness or anything in your ears, then it's not particularly concerning there. Okay. All right, so we can continue on. Just making a quick note of that. Your ear canals are very narrow and very shallow, so your eardrum is quite close to the opening of your ear, but your ears themselves are fairly small, so just have dainty anatomy, that's okay. Just making a note. Okay. Now, temperature variation on the left side was about 2 degrees above normal. Okay. All right, let's go ahead and move on. I'm going to do just a basic head inspection to start. I'm just going to take a couple of measurements of your cranium. So just have a simple tape measure here. I'm going to start by measuring for circumference. So I apologize, I'm going to go directly over the eye. Right at about 23 3 inches there. About 12.5 at the neck. Now I'm just going to measure from your clavicle to the back of your scapula, so just checking for symmetry from side to side here. And lastly, measuring at the spine. Fairly long torso. All right, so let's go ahead and move on. I want to do a couple palpations, specifically of your scalp to start with. So I'm going to come behind you. Do you have any pain or tenderness of the head currently? Okay. So just have you relax for me. I'm just going to feel around. I'll start back here at the base of the skull. So feeling for any irregularities here. I'm not noting any abnormal lumps there, so I'm just going to feel bilateral tension here behind the ears. And feeling along the mandibular joint here. Up into the scalp. Just going to feel for any abnormal lumps or bumps here. Feeling along the sinuses. Not feeling any excess pressure here. All right, so let's go ahead and continue, Lindsay. The next thing I'm going to do is a very brief heart and lung assessment. So I'm just going to be having a listen with my stethoscope. I'll place it in different areas and ask you to vary your breathing. So to start, I'd like you to just relax and breathe normally. Okay? It is fairly cold. I apologize. Very healthy heartbeat. It is slightly elevated in rhythm, but nothing that I would say is particularly concerning. So I'm going to have you take a deep breath in for me. Very good. Again. Again. Good. And one more time. Perfect. So I'm going to come around the back. You take a big deep breath in for me. And one more. Now I'm going to tap on your back, and when I do, I want you to hold your breath, okay? So Go ahead and breathe. Very good. Okay. So heart and lungs are very healthy. Slightly elevated heart rate, but you are the doctor, so that's okay. I expected there, so nothing to worry about. Just gonna take a note here. So we are +2 for cardiovascular assessment. Okay. All right, so we can continue with our assessment now. Let's go ahead and test a couple of reflexes here. So I have a reflex hammer. And okay, so I'm just going to do a very mild test for TMJ. I already tested slightly when I had you open and close. I didn't hear any clicking or popping of your jaw, so I'm just going to have you hang your jaw kind of lazily. Very good. Okay. And then you're going to feel me tap here. Just let me know if this is painful at all. Very good. So I'm going to do a reflex test of your eyelids. We have a natural reaction to close our eyes should anything come towards you. So I want you to just look straight ahead for me. You can keep your eyes open. Blink when you feel the need to blink, okay? I'm going to test that one more time. So this time I have a clean cotton swab. I'm going to bring it directly to the corner of your eye. Just a bit of a delayed reaction here on that left side. Okay, so nothing overtly concerning. I just notice a bit of a delay here on that side, but you do still close your eyes, so that's okay. All right. Okay. All right, Lindsay. Do you have any questions for me so far? Okay, so we're going to continue with an examination of your upper extremities. So I'm going to do some joint mobility testing as well as have a look at your hands. So I'm just going to start by feeling around at the joint here. So starting with your shoulder. Looking for any signs of dislocation or any other abnormality here. Scapular indentation is normal. Okay, so I'm just going to do a quick test for capillary refill. So slight pressure here at the fingertips and reaction time is normal. Very good. Okay, so I'm going to do a couple tests for your mobility here. So I'm going to bring your arm up and towards you, forward across your chest, and then out towards me. Very good. Okay. No signs of rigidity at the joints, so that's very good. Now, I'd like you to just rest your full weight into my hand here. Okay, so I'm going to repeat the same series on the other side. So again, just having a look at the shoulder, noting alignment here, as well as equal scapular indentation. Very prominent veins. I'm sure they have no trouble drawing your labs. Good. Testing for capillary refill. Fingers have warmed up since your arrival, so it could just be that you are a little cold. All right, so same test for mobility. So we're going to come up and in and then out towards me. Very good. All right, so I'm going to have you rest your full weight for me. Good. Okay, so no issues with joint mobility. Now I will go ahead and test your lower extremity reflexes since we're already working on it. So I'm just going to test at the knee. Slightly uncomfortable with this one, I do apologize. So just relax your joints for me. Very good. All right, so I think we can go ahead and move on to our lying portion of your physical exam. So I do want to have a bit of an examination of your abdomen, as well as have a closer look at your lower extremities. And then I do need to do one neurological reflex test at the bottom of your feet. It's just easier to do while I have you laying down. Okay, so I will let you adjust. Go ahead and go as far back on the table as you can, and then we will reassess. Okay. Are beginning with your abdominal assessment. Now I'm going to begin by just having a brief look at the alignment of your midsection overall, as well as looking at the pelvic bone in comparison to the thighs. So just looking for any signs of misalignment here at the waist. Just not notable. Also looking for any signs of abnormal distension at the abdomen, which is not notable. I'm going to assess your breathing for a second, so I'll have you just breathe normally for me. So just looking at rib placement upon inhalation. Also just going to hold down while you breathe. Alright, is it okay if I go ahead and raise your shirt slightly? So I'm just going to raise your shirt so I can have a look at the abdominal section. Right at about the rib cage there. Okay, so just looking at the midsection. I'm just going to bring these down just below the belly button there. My pen light, I'm just going to do an inspection of your skin to start. So, assessing for any abnormality in the skin texture, as well as looking for any abnormally raised areas. Not feeling anything below the surface either. And again, just assessing your breathing. bit of a palpatory assessment, so I'm just going to feel around with my fingers. Now, very gentle pressure to start here, feeling directly underneath the rib cage. Feeling any signs of distension there, so feel at the midpoint here, falling down toward the umbilicus, looking for any signs of abnormal distension or any bloating. Slightly deeper palpation at the right lower quadrant. And left lower. Just going to feel bilaterally here for a second. Feel around for any signs of umbilical hernia, so any distension underneath your belly button, which is so far not notable, placement and shape as well as well within normal limits. It's a good sign that there's no underlying abnormality there. So I'm going to do some percussing along the abdominal wall. Just going to further percuss with my reflex hammer here. Now you're going to feel a light tapping on your rib cage. Shouldn't cause you any pain, might feel slightly uncomfortable. We can take a couple of measurements for symmetry along the bone structure here. So I just want to make sure that there's no notable edema, particularly along the rib cage. So just testing down that lower left quadrant here. I do apologize, this tool is rather cold. Nothing notable here. Symmetry is fairly even. Just going to measure the entirety of that lower quadrant here. Just going to test for any signs of abnormal edema here, so just checking for normal reactivity, no signs of delayed indentation. Very good, healthy reactivity. reactivity here along the mid abdominal wall. So I'm also going to test for reactivity of the muscles. So have you just relax for me as I test a couple different areas. Testing bilateral reflex response first. So I'm going to go back and forth and test side by side and make sure I'm getting equal reactivity on both sides. Getting mild reactivity, but I would say it's in line with what I would consider normal. Slightly stronger there at the midpoint. Just going to test linear. Slightly more elevated response there. Alright, so I'm going to do a stethoscope assessment of your abdomen. So similar to how I tested your heart and lungs, I'm going to have a listen at the abdominal cavity. So just breathe normally for me. I'm just going to listen over a couple different areas, starting here on the left side. Good. Okay. So I'm just going to do a last round of palpation here, make sure that I didn't miss any signs of distension or anything underlying the abdominal organs. So I'm going to feel slightly deeper here. Listening for any signs of abnormal hollowness, which is not notable. Okay, well, that looks okay. All right, Lindsay, I'm going to move on to a brief test of your lower extremity. I did do a gait assessment when you walked into the room, just kind of observation. I didn't notice any wasting or any signs of atrophy at the lower extremity. So just having a look at your joints, I do see fairly aligned at the knees as well as at the ankles. Pelvis alignment as well, so I feel around a couple different areas, feeling for any signs of tenderness as well as any swelling. Just having a look at the ankles. Okay, so testing for lower extremity mobility. I'm going to raise your legs here. We'll start with the left. So I'll have you bend at the knee, come up towards your torso, out towards me, and across. Very good. Very good. So same on the other side. Gonna bend at the knee, up towards your torso and out, and then over towards me. And ankle rotation, no signs of rigidity there. So let's see. Just testing a couple different points here so I can get a good gauge on the reactivity, and so far I would say slightly mild, but I am seeing bilateral sensitivity there. So just slight percussion of the joints. Oh, good. Okay. All right, Lindsay. That is going to conclude our head to toe assessment today. Now I have quite a bit of notes to catch up on for your preliminary test. Since you are a first-time patient, I would like to continue seeing you on an annual basis. So we can either make that appointment ahead of time or you can call in and schedule. Either way, I'm going to head back to my office and finish my dictation. In the meantime, you are welcome to relax here for however long you feel comfortable. Okay?